Serious new questions this morning about the quality of health care under the new Affordable Health Care Act. Many patients are now asking, will I still have access to new treatments? Will my premiums go up? Will I have to wait longer to see my doctor? Here now is our doctor, Dr. Mark Siegel, part of the Fox News Medical Aid Team, Associate Professor of Medicine at NYU's Langone Medical Center. Good to see you, Doc.
Greg, good to see you.
Clearly, doctors such as yourself who treat patients every day are going to have to take a huge hit on this thing. But you're really concerned about the 250 million Americans who you believe, you're absolutely convinced, are going to see health care diminish. In what ways?
Greg, because I talk a lot about how this is going to impact doctors. But the fact is, most doctors are not going to quit. Most doctors are trapped in their profession. Most are super specialized and can't do anything else. But the thing is, if they're disgruntled, why? Why are they unhappy? What are they worried about? And I want to bring that to America's patients. As you said, 250 million Americans already have health insurance. So much focus has been on the ones that don't. What about the ones who do? And I'm very worried about high-tech solutions, about the latest treatments.
A cure, for example, that I might not be able to get access to with coverage.
Absolutely, because you have 33 new committees with Obamacare. You have the Independent Medicare Advisory Board. We've seen from the U.S. Preventative Task Service Force that they're starting to go against certain treatments or tests that I like to order, mammograms over 40, CAT scans for detecting early lung cancer in smokers. Sure. Greg, these are specific things that I've actually used to save lives over the last few years. I have found lung cancer early in smokers using CT scans of the lung.
Right.
I'm worried that that test isn't going to be approved by insurance going forward. Same problem with mammograms. Same problems with Pap tests. When you start having all these guidelines, if insurance weighs in on them because they're trying to save a few dollars, we might not have the options. And we're going in the direction of personalized medicine, which is very expensive. But if you think Obamacare is going to cover that,
right.
I don't.
Let me hit a couple of things. First of all, flex spending accounts, they're going to go down?
In the United States, we already only spend 12% out of pocket for our medical costs. That's very little. And one of the most disturbing things about Obamacare is it makes it much, much worse. It shrinks your the flexible spending accounts. You can only use up to $2,500 per year. Right. You also have very little copays, very little deductibles that will be allowed, grandfathered in, and you're only going to be able to deduct medical expenses if they're more than 10% of your gross income. That means that you're not going to be able to see. I like it when a patient comes to my office and says, I've been looking at this and I can get a tax deduction, but I'm not sure if I need that test. So patients look more carefully over what it is they need when they can spend out of pocket.
Do you anticipate rising premiums for people out there and decreased access to doctors because there's going to be a doctor shortage?
I think everyone out there, Greg, knows that there's going to be rising premiums as we extend the bells and whistles to more and more people.
You got to pay for it.
Yeah, but I don't think people realize it's one of the biggest myths of Obamacare is this idea that access is increased. How is access increased if my waiting room is already full and I put more people in it? How is access increased if I decrease the amount of time I have to spend with you to 6 minutes? How is access increased if you have to call 3 months in advance to get an appointment, the way it's true in Massachusetts right now?
I can hear
access is not increased.
I can hear it now. Mr. Jarrett, you can only see Dr. Siegel for 5 minutes. Sorry, that's going to be it.
Dr. Siegel, you can always see for more than 5 minutes, but I can't vouch for the entire country of physicians.
Dr. Mark Siegel, many thanks. Check out his column, by the way, on foxnews.com. You'll gain more information about the subject we're just talking about. Martha?